All right, our next Mythbuster is about pressure ulcers. It takes 24 to 48 hours for a pressure ulcer to develop. But that is actually false. A stage 3 or 4 pressure ulcer can develop in as little as 1 to 2 hours. Pressure ulcers are caused from a lack of blood flow to the area because of the pressure on that area. I actually took care of a patient. She went in for a laparoscopic procedure and then wound up having complications and having to have open heart surgery. Now, in that surgery, they were much more concerned with saving her life and taking care of her heart issue than they were with her skin. So when she wound up getting to the rehab, her entire buttocks was completely black with a deep tissue injury. And so that happens, it can only take a couple of hours for that pressure ulcer to develop. They were not repositioning her, they weren't prepared for her to do open heart surgery, and that pressure ulcer developed. So what I did was I brought the family in and I showed them what was going on so that they would be prepared to know that that wound was eventually going to open up and probably look a lot worse before it got better. So we wound up doing a fun thing at the rehab with our nurses and therapists where we asked them a bunch of different wound questions for National Pressure Ulcer Advisory Day. And one of the questions we asked them was, how long does it take for a pressure ulcer to develop? And I was surprised to see how many people actually put down 24 to 48 hours. But that's false. It only can take a couple of hours for that pressure ulcer to develop. Our next Mythbuster is nurses and therapists are not responsible if the doctor orders an improper treatment.